Doctor, how are we doing today?
Robert Koenig is in the hospital again. He says it seems like every year he's admitted at least once.
Past 4 years. I started out with chronic kidney disease, diabetes, congestive heart failure, hypertension.
His goal is to stay out of the hospital. His clinical care team wants the same. That's why Robert is a part of Mary Greeley Medical Center's Transition Care Program. It's an effort first launched in 2012, despite already having one of the lowest readmission rates in the state.
It is really on the front end, prevention, but then on the back end, it's that we are committed to transitioning with them when they go home throughout their continuum. And so it isn't just while they're here. They're also our patient when they leave here.
The program includes all patients admitted with heart attack, heart failure, chronic lung disease, or pneumonia, all conditions known to have high rates of readmission. Mary Greeley's approach begins by providing the patient with educational materials.
So the first thing we did was we standardized that education. So as they move through the transitions of care, whether being hospitalized or going to home with home care or upon their follow-up visit, we were all educating the patient on the same thing and reinforcing each other.
The information is reinforced at a multidisciplinary discharge planning meeting, right in the patient's room.
We want to give you guys education.
The patient's entire team is there. Case managers, RNs, social workers, respiratory and physical therapists, dietitians, and pharmacists.
And we've recognized how important it is to make sure that they have the resources when they go home, that they have the education, that they have a good plan for when they go home. So that if things do change when they get home, their condition starts to deteriorate, that they have tools, that they've had education, and that there's a plan on how to handle that.
Oh, are you Robert? Nice to meet you, Robert. My name's Ashley.
Once the patient's at home, they get a free visit from a Mary Greeley Medical Center home health nurse within 24 to 48 hours.
I like to go over your medications one by one. We'll put them in the computer. We'll talk about any kind of interactions we want you to watch for.
And the visits are paying off. Nurses are finding that 70% of patients visited at home either are not taking their prescribed medication correctly, or the medications they are taking could interact with each other. The nurse also does an environmental assessment and reviews information received at the hospital, including the helpful home management plan that uses an easily understood stoplight.
You've got green, yellow, red. Your green is what I tell people that's your normal.
Symptoms in the yellow area might mean a phone call to the doctor's office, while symptoms in the red could require a doctor's visit or trip to the emergency room. Another important part of the transition of care program is a follow-up appointment with a physician within 3 to 5 days of discharge.
The data shows very clearly that programs such as this definitely improve the care of the patient and also improve their chances of being able to stay home, which is where they want to be anyway.
Another way for patients in the program to get advice and answers to their questions is through Mary Greeley's First Nurse. It's a phone line staffed by experienced nurses who call transition care program patients 2 to 3 times per week for a month.
They're making sure that everything is okay with these patients, and if they need additional resources, they're making those referrals as well.
Mary Greeley is not only seeing success through this program, they're looking now to expand it to nursing homes.
A lot of these patients have chronic illnesses, and so it's helping them to, live with that in a way that allows them to have quality of life. This is how healthcare really is intended, is to give the patients the tools they need so that they stay well.